Hello there and welcome. Today we are here to speak about a topic that doesn't get too much traction here in Sri Lanka, but is a burning issue here in this country that has seen many crises unfold throughout the past few years. Postpartum, the good, the bad and the ugly. Sri Lanka's mothers, of course, are highly, at times, under a lot of stress, especially after they give birth to their children. And this issue kind of evades the bigger picture, given the other crises that the country is facing at the moment. But this is an important issue that needs to be addressed. And if you are wondering what a guy like me is doing in this discussion, don't worry. I've got a very, very capable co-moderator with me who has first-hand experience in all of this, Mrs. Jerusha-Thambia, an attorney at law and a proud mother of two who recently gave birth to her second son. Congratulations, Mrs. Thambia, and welcome. Getting to know our guest today, we've got with us Dr. Suhashini Rathnathunga, consultant psychiatrist at the National Hospital of Sri Lanka. She's also a senior lecturer at the Faculty of Medicine at the University of Colombo. Hello, doctor. Thank you very much for taking time off your busy schedule and joining us here for this discussion on postpartum, the good, the bad, and the ugly. Also, we've got with us Dinendra Jayasinghe. She, of course, as you would see, is a personal fitness coach. She has 12 plus years experience in the field of strength and conditioning. She has a bachelor's in applied science and sports coaching from the Deakin University of Australia, and she's also a level 2 cricket coach. Thank you very much, Dinendra Jayasinghe, for joining us on this program today. So, let's get right into it. For those of you who are a little bit unsure about what exactly postpartum is, what the parameters of the postpartum period are, I believe Dr. Suhashini can shed some light on that subject. Doctor, what really is postpartum? How long does it last? Let's start there.
Okay, so postpartum, simply speaking, is the point at which the mother gives birth to her child. So from that point onwards, there is a very broad definition that up to 1 year is considered postpartum. It's a simple definition, but there is a lot of complex interplay during that time where biological, psychological and societal causes can have a huge impact during the postpartum period. So biologically, there are huge hormonal changes that are happening in a woman's body. Psychologically, she is now preparing herself to a new role, a role as a mother, and probably her roles as a wife, her role as a daughter, her role as a working woman will also alter to a certain extent. And from a societal perspective, the way society views her, and also this question, am I a good enough mother? Am I a good mother? Am I doing my best for my child? And what does society expect from me as a mother? All these concepts are changing. So it's a very important period in a woman's life that I'm sad to say sometimes does go unnoticed. So I'm glad that you brought this up and that we're talking about this today.
So to further elaborate on what you just said, a mother is always expected to play these different roles. So a working woman, a daughter, a sister, a wife, and then primarily a mother. The thing is, society also expects you to be really good at everything and perfect and handling everything very well. As most Mother's Day posts suggest that you're a superwoman, you do this, you do that. But in reality, there is a lot of things that are hard to do. So just to start off, I'd ask you, how would you deal with this kind of prejudice that pressures mothers into doing so much and guilts them if they're unable to do all of that at the same time and well?
Yeah, you're absolutely right. So we now talk about not being a good mother or a super mom or the perfect mom. What we advocate is to be a good enough mother, right? A good enough mother is where you're able to care for your child and attend to your child's basic needs. A good enough mother will make sure that a child is healthy, the child is well cared for, you're bonding with your child, And as long as your child is thriving and you take the child on time for the vaccination appointments, when the child falls sick, you're able to identify that your child is not well. You're able to provide the nutrition and the stimulation for the child. That's all we should expect from a mom. But unfortunately, whilst caring for your child, society also expects us to be that perfect wife, that that perfect daughter-in-law, or the perfect working woman per se, right? And we need to understand that each woman is different, and each woman's priorities are also different. One woman might think that looking after her child is her main responsibility, and she might take a back step from working, from her other duties. So what we now advocate is be a good enough mom and try to balance other aspects in your life as well. Remember, during the postpartum period, your libido goes down, so you might not be as sexually active as before. When you during a postpartum period, your fitness levels goes down, and I'm sure she'll talk about it more. So then you might you're probably not that busy woman you used to be, and you're not capable of doing that. So what we say is, we try to get that pressure off of painting this perfect picture that I've given birth and I'm now this this very capable person. It is a time of adjustment, and take time, and women who have taken time to adjust to this new role actually do perform very well.
I think Dr. Suhashini spoke a lot about the toll that pregnancy can take on a woman's mental health, of course, because they are being part of the miracle of life. They are bringing life to this earth, and of course that is a very challenging experience, and it does take a toll on a woman's mental health. But let's now focus a little bit on the physical side of will, and for that, of course, we've got an expert in the field, Dinendra. Now, Dinendra, you yourself are a mother, and as a person who is in the fitness industry, would I be correct to say that having a child was a little bit more of a challenge for you, given your industry, that it demands a lot of physical work? How did you really deal with during your postpartum period after having a child and being a part of the fitness industry itself?
To be honest, there was a lot of pressure to get back to my postpartum self. There was an extremely lot of pressure to get back to my postpartum, like my body had to be back to how it was beforehand. And I put a lot of pressure on myself to get back to where I was, which I should have known that I shouldn't have done. So I gave myself a goal of being back to where I was in 6 months, which was not realistic. Even for somebody who had the expertise to know what to do, I couldn't do it. It took me a good year to get to where I was after having a child. And I think that's very important for everybody out there to understand, that it will take you at least a year after having a child to get back to where you were. And you need to give yourself that time. You need to be kind to yourself and just focus on your baby and give yourself that time. Do not rush it, because your body needs to heal. Your body needs that time to heal.
Dinendra, this is coming from a fitness expert, and you say that it took you 1 year. I don't think many women here in Sri Lanka, or across the globe even, would be that kind to themselves to say, I'll be back where I was in a year. I don't think even society gives them that opportunity.
No, because most people think, oh, okay, 6 months, that's all you've got. 6 months is all you've got. It does not happen. My first child I had, yes, I bounced back into shape. 6 months, I actually did. But when you have a second, third child, it's not as easy, because you have a lot more pressure. You're looking after another child. You have your household work. If you're working, you have work. You have to look after your parents. There's a lot more things that go on. So it's very difficult. And finding that time to exercise, that takes a lot of time, because you have to mentally space that into your working life. Like, I get up at about 4:35 to fit in my exercise. So you have to schedule that into your life.
So turning to Dr. Suhashini, my second question would be what some of the mums, the real life mums, spoke about was that what affected them the most was their relationship with their husband. I think the Pepsi Cola chairman said it well. She said if he's on your list, he should be thankful because you have so much going on. But I want to know from you, how would you advise a mom who's going through this kind of thing and having to deal with also her husband not possibly understanding why things have changed? How would you advise someone like that?
So during the postpartum period, social support is everything. And I mean, there is very clear evidence, research that goes on to show that if a woman is supported socially, I mean psychologically, financially, and with support to care for her baby, the woman actually does quite well. We do see that in a low socio-economic, middle social, I mean, in all strata socially, but there are now with a lot of urbanization and probably people migrating, working people in and around Colombo, most women are, they're by themselves. And when you have to break rest, breastfeeding a child and then looking after household chores, that can be very, very demanding. And then it can pose a risk to your mental health as well. This child is a consequence of the mother and the father. So it's important that the father takes responsibility in caring for the child as well. If I'm to give a very brief, very important message, if you love your child, then love the mother, and that is the best way to show your child that you love them. So supporting the mother in looking after the child, in caring for the child, goes without saying that it is probably the most important thing, a father's role in this. So the message is basically, give your wife, give the mother a break. So what we say is, when the baby sleeps, the mother needs to sleep. In Sri Lanka, unfortunately, when the baby sleeps, the mother is busy washing nappies, the mother is busy mopping, sterilizing bottles. But these are things the husband can do. So, and it's not beneath you. Some men in Sri Lanka think it's beneath them to mop the floor, to wash the nappies, sterilize the bottles. But if you support in that, those are small ways where the mother can get rest. The mother can kind of, rejuvenate and kind of, get the rest the body needs, basically, mentally and physically. So if the husband chips in, it's a very, very important contribution towards the mother's recovery. And also when the baby wakes up, the mother is not exhausted to breastfeed, exhausted to bond with the child. So, yeah.
So, Dinendra, speaking about working out, fitness, the physical aspect of a mother, these are not things that are taken into consideration too much, at least working out. I mean, you don't see society go and asking a new mother, when are you going to start working out? They'd probably be like, what's next for your child? What do you think, you should do for the betterment of your children? The mother, or the physical health of the mother, doesn't feature too high up on the list of priorities for the mother, for the father, or for society in general. So how important do you think it is for a woman to start working out or resuming physical activity after giving birth?
I think that's extremely important for the mother to start working out. I mean, things like your Kegel exercises, your pelvic floor exercises, you should be doing at least 3 days after you give birth to your child. I mean, that's really important, and I don't think we emphasize enough of that. At least 3 days after, you should be doing that, and 6 weeks after your postpartum checks, you should be starting to exercise. That's what we need to drill into our mothers. You need to start exercising 6 weeks after giving birth. You need to start going for walks. You need to start doing your squats, your push-ups. You need to just start getting into your regular exercises. High-impact exercises, give it some time, but regular exercises, you need to start after 6 weeks. Get your all clear from your gynecologist and start exercising. It's good for your mental health as well as your physical health.
But Dinendra, in Sri Lanka, working out in general, although there has been a slight uptick in recent times, especially with maybe some government publicity even given to gyms and all of that. But still, among women, among mothers, this is not very popular.
That is true, but I'm of the concept that you do not need to go to a gym.
Okay.
You do not need to join a gym, you do not need anything fancy. You just need a space at home to do exercise.
Probably a mat.
Just a mat. You don't need anything. You just need to log into YouTube or some safe space for you, find out some exercises and just do them at home. You don't need to go anywhere. You just need to figure out what you need to do for your body and do that. 20 to 30 minutes, that's all you need to do. But you need to do that for your own mental sake. Because your child will benefit if you've done a workout. Because you will feel better for yourself.
Dinendra, just to emphasize on the importance of this, how would you say the difference would be in a woman who worked out after she gave birth to her child and a woman who didn't work out or doesn't work out afterwards?
I think the issue here would be your body images. I mean, I know aesthetics isn't a big part of it, but for women, it comes into play. So if you don't work out for yourself, not for anybody else, if you don't work out for yourself, later on in life, you'll be like, oh, why didn't I take care of myself? And if you don't take care of yourself after you have a child, it is a lot harder to get back into shape. If you leave it for 2-3 years after you've given birth, it's a lot harder to get back into shape. So I would advise you to do it 6 weeks after you've had a child, get back into it.
If I can ask you a sub-question, you said 6 weeks. Does the time frame change between C-section and natural birth?
Even for C-section, get your clearance after the 6 weeks checkup and then they'll give you slow progressive exercises.
So now moving on to Dr. Suhashini again. There is a lot of talk surrounding postpartum depression, more than there used to be. I want to know two things. How would you advise a new mom if she had to flag, or a new mom or the community that helps her, if she had to flag that this is what she's going through? And number two, does this kind of thing change with your strata, of your economic strata? Do you see differences between how these stratas assist or do not assist with this kind of thing? So how do you flag it? And is there a difference in how communities?
Okay. So early recognition is everything. Okay. So to understand or to recognize a postpartum depression, I believe that it is the duty of society, family members and yourself. So everybody, because sometimes the mother themselves are not able to recognize that they are probably psychologically unwell and they might even normalize it. So it's important that all of us as a society know what the symptoms are so that we can recognize it in somebody and say, oh, look here, I mean, you might need help or you might need to meet a professional and get the clearance. So the common features, I mean, postpartum depression is not different from any other depression. So the clinical features are very similar to a non-pregnant or any person. So the common clinical features are persistent low mood, a lack of energy, a lack of interest in the things you used to enjoy. So if you're somebody who loved exercising, somebody who liked listening to music, then you might not feel that you want to do that anymore. Or you, even after doing it, you might not feel any joy in doing it. Then a lot of pessimistic thoughts about yourself, pessimistic thoughts about the world, pessimistic thoughts about the future, the self, world and future. You might feel very hopeless, you might feel helpless, and as a mother you might feel that you're not good enough, that you're not a good mother, you're not doing what you should be doing. You might start doubting yourself a lot. You also have biological features like lack of poor sleep, poor appetite, and then the more dangerous symptoms like so when you start developing a sense of hopelessness, you start developing thoughts of wanting to harm yourself because I'm not good enough. It's better off if I'm dead. I'm a burden to my child. I'm a burden to my husband. So it's better off if I end my life. That is when postpartum progresses. So if you see this in a family member, in anybody, in a friend, then the best is that you encourage them to seek professional help. A lot of people in Sri Lanka are very reluctant to meet psychiatrists. For many reasons. Some people are worried about the stigma. I know some of my patients don't like to be seen seated outside my consultation room, thinking that others might see me and might judge me. Some people don't like to go to a psychiatrist thinking that the medication they prescribe will be addictive and I'll be hooked onto medication for the rest of my life. Some people worry about medication thinking that it might change my personality, it might change the way my creativity. So there are lots of myths regarding mental illness and medication. Some people are worried that I'm worried that she might give me shock therapy. So lots of reasons why people are reluctant, even after recognizing that they might have a problem, are reluctant to meet a psychiatrist. So all these are myths, probably another day to discuss. But so if you see this, then yes, you have to encourage people to go and get professional help. The second part your second question is, there are risk factors for postpartum depression. And I think by being aware of the risk factors, you can probably think, okay, if this happened, I'm at risk, therefore I need to probably get help early. The common identifiable risk factors are a history of depression. If you have been treated for depression or you have suffered depression at any point in your life, even as a child, the chances that you will develop postpartum depression are very high. If you have any, not just depression, but any other mental health condition, like probably alcohol dependence, substance misuse, and anxiety disorder, that puts you at risk. If you have a family history of depression, again, it puts you at risk. If you develop depression during your previous pregnancies, then again, that puts you at risk. Like you said, so the socio-economic factors, if there is domestic violence, if there are ongoing financial stressors, social stressors, again, that puts you at risk of developing depression.
So why I asked was, I do family law, so my clients also don't like to be seen outside my office, much like yours, but I have done quite a few cases where I thought, I'm not a psychiatrist, so I wasn't able to give them a verdict, but I thought this woman was going through some kind of depression, but the husband thought, this woman's completely mad and I must now run away. So would you say it would be like, so for cases like that where both parties are unable to see what's going on, do you think a third party or communities will have to then flag it for them and send them or try and convince them to see a doctor at the earliest?
Definitely. So in a way, our public health sector is, it's set up to a point, very well. As Sri Lanka, we should be very proud of our public health sector, because after a mother gives birth and mother goes to the community, the midwife has a register and the midwife makes visits. There is a schedule, and the midwife produces what we call the Edinburgh Postnatal Depression Scale, the EDPS. It's given to all mothers, where the midwife is able to recognize postpartum depression very early. And when it's flagged, then she does the necessary referral. So in the public health sector, we do get referrals where the midwives have recognized this through this scale and we treat them. Unfortunately, in the private sector, midwives don't visit and there is follow-up is entirely up to the patient. In that case, it's very important that family is aware of this issue. The problem with not only postpartum depression but any mental health condition is that it's not a visible illness or it is not a demonstrable illness. Like if you're suffering from the flu, you will cough, you will have a cold, you will have a temperature. If you break your leg, you won't be able to walk. But mental health is not like that. And a lot of people think that maybe the patient is faking it to get attention. Maybe the patient is faking it to get insurance cover. So that is why it's so important that people are aware of what mental health problems are, so that they are able to recognize the subtle signs, not the very obvious signs, and then make the necessary referral.
Dinendra, since we're in the final few minutes of this program, real quick one, but it's a bit of a complicated issue, of course. Striking a balance, of course, has become harder now than ever. Because I think if we move back maybe 50, maybe 100 years back, women had established roles. They usually were housewives, The husband used to provide for them, but we're living in a very, very different time. Women are working, women are taking care. They're still doing their traditional roles, but they're also working. So it's an additional burden. They're expected to be a traditional woman. They're also expected to work. They're expected to provide for the family, further their career. So you highlighted the importance of physical activity, getting back on that physical track. How do you suggest that a woman living in the modern age strikes a balance with all of this? Because besides her traditional role, she has to focus on her career, and now she has a child to take care of, maybe 1, 2, 3 children. How do you strike a balance here?
So basically, when striking a balance, you just have to be practical. Don't put too much pressure on yourself. Be realistic, and you really have to just think, okay, I'm a mother first. You have to take care of your kids, and everything else comes second.
So that's priority number 1.
For me, that's priority number 1. My kids come first. So whatever I have to do for my kids, that's first. Work is second. My husband is unfortunately third. And that's how it goes. And
Where does
he's fine with it.
workout and husband? Workout is fourth.
Workout is fourth, unfortunately. But that's okay for me. My kids are first. And that's what works for me. But everyone is different. Okay? So you have to figure out what is important for you. Okay? And what works for you. And there's no judgment, there's nothing. That has to come down to what works for you and what works for your mental sanity.
So that's a very, very personal
That's
choice.
a very personal choice, and you have to be okay with it. Don't let anybody else tell you what's right for you. It has to be okay with you, and it has to sit well with you. So for me, working out is good for my mental health, and I do get that in. But first, my kids. I do whatever I have to do for my kids. But for me, workout, I get up at 4:30 in the morning to do that. So I fit that in before my kids wake up.
So it has to be a very, very practical and personal approach.
Personal approach, yes.
But of course, there are demands from society saying, your career should come first, or your husband must also come first.
I think you have to have a balance with your husband also. Your husband has to have an understanding, which my husband and I have. So he understands that I need to work out, and he gives me that time if I need it. And I give him his time to work out in the evening, so we've got that balance.
I'm yet to see a list where the husbands come first.
So, one final question, Dr. Suhashini. You've been working in this industry with women, helping these women here in Sri Lanka for many, many years. You would know the issues that the women face, the biggest issues that these women face. If there was one thing, one big piece of advice that you could give women who are going through their postpartum period, what would that be?
It's difficult to find one big answer, but okay, so a big answer would be, how do I say it? Right, like what Dinendra said, I mean, it's important that your child comes first, but also I feel that in Sri Lankan society, the woman is neglected. When people come to visit, they always ask, "Baba kauda? How's the baba? Duekta putekta?" Nobody inquires after the mom. So it's important that society starts looking at the mother as well as a very essential component in this mother-baby relationship. Understand that this is a new role, and that this is a changing role for the woman. Understand that nobody said it was easy, right? And it takes time, it takes patience, and it takes practice to adjust to this new role. Some people think that, the moment a baby is born, it's a bundle of joy, and now, you need to feel happy. That unfortunately doesn't come naturally for some women, and that's okay. Because you are, again, your body, your mind, it's a time of adjustment. So it takes time. Sometimes you might not even feel happy. You might feel you might feel overwhelmed with the number of hours, the baby takes off your time. So that's okay. From a society perspective, we need to support women. And we need to give her time to adjust, and not expect her to be this fantastic new, mother who is supposed to have all the skills in breastfeeding, to looking after, to carrying this new baby. Be aware and be aware of certain mental health conditions that can happen during the postpartum period. Awareness and education is everything. If they are detected early, the chances of cure is almost 100%. So don't be shy, don't feel that it is a weakness in personality to seek help. If your wife is having trouble, get help. That help is available anywhere in Sri Lanka. And there is professional help available. And don't be afraid to meet a mental health professional. You're not going to be labeled crazy, right? And majority of the patients who come to me actually don't require medication. The chances we prescribe medication is, it's a very small percentage. All they need is some reassurance. That reassurance coming from a professional is actually quite encouraging. So go, and get help. Take time and prioritize what is important to you, just like what she said, right? So and in that priority list, you also have to be included. Taking time to sleep, taking time to exercise. And I always tell my patients, there has to be me time. Me time is where, you don't have to think about your baby. You don't have to think about sterilizing the bottles. You just have time for yourself. And something I advocate to the husband or the father is take over the baby's responsibility and tell your wife to leave the house. Just go out and go and do some shopping, or just go to the salon, spend 1 hour there. Just go for a walk where you have time to just time for yourself. That is extremely important. Otherwise, you're always thinking about what comes next. When is my baby's next feed? So baby wakes up, feed the baby. If you're breastfeeding the baby, 1 or 2 hours is fine, right? It doesn't mean that you're a selfish mother. It doesn't mean that you're not a good mother. You're not spending 24 hours with the baby. That it's good for the baby as well, right? Apart from the primary caregiver, to get used to other people being in that baby's life. It's good for the child's emotional development. Otherwise, the child is going to be a very clingy child. That's not what we want from our children. We want our children to be independent, to be confident. So have that me time. And that does not mean, this is a message I find very difficult to sell to our mothers. Having that me time is not being selfish. It is finally for your mental and physical well-being that translates to you being an energetic, positive, confident mother.
I have a follow-up question. There's a lot of talk now about fathers going through postpartum depression. I wanted to know if it's a recognized thing and whether you see numbers increasing.
There is, research coming out showing that there is a lot of paternal anxiety and paternal depression. Again, probably because our social structure is now shrinking, where we don't have time, where extended families are unable to support, where in some companies fathers don't get paternity leave and therefore they are sleep deprived. If you have lots of children at home, then fathers have to look after the children in the night, and then they are sleep deprived. They have to go to work and perform. So it is now, yes, almost a recognized entity. And again, that is again a treatable condition. If they are at the threshold of anxiety and depressive disorders, then they need help. And that does not mean that it is a weakness in your personality.
Dr. Suhashini, we spoke about a lot of advice, a lot of things, do's and don'ts for mothers, and now with your new statement for fathers as well, to deal with this postpartum period. Just to highlight on the importance of these advice that both of you have given to mothers as well as fathers to deal with the postpartum period. Since you've worked in the industry for so long, what would be a worst case scenario that you've experienced, and also what would be best case scenario of a person who has adhered to at least a majority of these advice that you've given?
Worst case scenarios are, we have had mothers who have presented to us with attempts of suicidal attempts, mothers who have harmed themselves. And when you do look at them retrospectively, these mothers have been having signs and symptoms of postpartum depression for months. And it is, it's atrocious. How they have been neglected, how some families have actually recognized this as a mental health disorder problem, but were reluctant to bring the mother to hospital to meet a doctor because of the stigma associated. Okay, let's not go and meet a psychiatrist, then for the rest of her life she'll be labeled as crazy. It's bad for the child, it's bad for the husband to be married to such a woman. So, and then, I mean, untreated depression is one of the commonest risk factors for suicide that is recognized all over the world. And I mean, it's very sad. And this is something, if it had been detected early, could have been treated. And remember, depression in a mother is extremely detrimental to the bond between the child, baby and the mother. And if your mental health is, if there are abnormalities in your mental health, that will have an impact on your bond with the child. And that is something, again, that can be preventable. So those are, and sometimes, I mean, the very, very rare cases of postpartum psychosis, which has resulted in infanticide. It's not very common, but yes, it does happen. Then there have been cases where the mother has actually killed themselves. And then when you look back again, these were cases that should have been detected very early on. And if they had been detected and treated, this could have been a very preventable case. Then, I mean, the positive news is, fortunately, I mean, in Sri Lanka, things are now moving towards the positive, where it is now a recognized entity. Family members are able to recognize postpartum depression, and patients present to us even after 1 or 2 months of 1 or 2 weeks of symptom onset. Probably sometimes over-enthusiastic family members bring them, saying that, I wonder whether she's depressed. And then we say, okay, hold on. This is what you can do to improve her mental state. Let's monitor her and see. That is all that is required most of the time, just to monitor the mother's mental state. The main reason is people are worried that we might jump and, stuff them with pills. That's not how it works. We monitor the mother's mental state, and if we see a deterioration, and if we feel that this is beyond psychological therapies, that is when we admit or recommend medication. But it's always a discussion between the mother and the patient, the doctor and the patient. And I mean, medication or any other therapy is advocated only when it is required.
So Dinendra, with your years of experience with working with postpartum mothers, what would you say your key observations were that would be helpful for someone who's going through that stage? And what would you say was an ideal case that you saw, and one that didn't go as it should have?
So basically, the keys is the 4 R's for me. So as soon as you have a baby, rest, recover, rehabilitation, and retrain yourself. Okay? So those are the 4 main things. The other thing I would say is start working out as soon as you've had the baby. Like, as 6 weeks, go do your checkup, doctor gives you the all clear, just gradually ease into it, start working out. Okay? I've had a lot of cases where women come to me where they've had separation in their stomach after giving birth, they've got a gap in between, so like separation between 3 or 4 centimeters, and you can fix that as long as you exercise and you know what you're doing. But what happens is most women don't exercise, don't do their core exercises, so then this gets worse, and then they have to go into surgeries for it. So those would be the worst case scenarios where you don't fix yourself by doing exercises, and then you have to go into surgeries. Cases where I've actually been able to help people have, like, they've had 3 or 4 centimeter separation in their stomach, and been able to help them get back to normal, avoid surgeries. So, everything is possible as long as you can find somebody to help you.
So we've had a very, very productive discussion on this topic that doesn't garner too much attention here in Sri Lanka, but is of course an important burning issue in this country, especially given the change in times and the modern day demands of a mother. I think, as was highlighted during the program, a mother is expected to be performing her traditional roles of taking care of the child, doing some of the housework and so on. The mother is also expected to be normal and as if nothing has ever happened. After giving childbirth, the mother is also expected to pursue her career, and that is not fair, as I think we can come to a conclusion by the substance of this discussion. So these points that were spoken of today about the postpartum period, under the theme Postpartum, the good, the bad and the ugly. We hope you find them very useful in dealing with these issues. It could be yourself, it could be a family member, it could be your wife, but this is a very important part of society, of life, that needs to be taken into consideration. And thank you very much, of course, first to my co-moderator, Mrs. Jerusha Thambiah, for of course assisting in moderating this entire panel discussion, and also Dr. Suhashini Rathnathunga for coming on board and sharing her expertise in this field. Also, thank you very much, Dinendra, Jayasinghe, for highlighting the importance of physical activity during the postpartum period. Thank you very much to all our viewers also for tuning in. We hope you take this advice positively, and we hope that it betters your life, the life of your family, and the life of your child.